Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Do you know the top 5 deadliest diseases in the world? Our journey today will take us into the often unseen world of these silent killers. We'll delve deep into the symptoms that signal their presence, the methods used in their diagnosis, and the treatments that can combat them. Moreover, we'll explore how to prevent their onset, arming ourselves with the most powerful weapon of all: knowledge. Prepare to gain knowledge that could potentially save your life or the life of someone you care about. Number 1 on our list is cardiovascular diseases, the silent killers. These are conditions that involve narrowed or blocked blood vessels, leading to heart attacks, chest pain, or strokes. The symptoms can be quite subtle: shortness of breath, chest discomfort, lightheadedness, or even nausea. To diagnose these treacherous diseases, doctors often use tests like electrocardiograms, stress tests, and cardiac catheterization. Once diagnosed, treatment can range from lifestyle changes and medication to more drastic measures like surgery or medical procedures. But don't fret, prevention is possible. Regular exercise, maintaining a balanced diet, and avoiding tobacco and excessive alcohol can significantly decrease your risk. Regular checkups are also crucial for early detection. So let's keep our hearts in check, folks. After all, it's the engine that keeps us running. And remember, it's never too late to start taking care of your heart. You have the power to prevent cardiovascular diseases. Remember, a healthy heart is a happy heart. Coming in at number 2, we have the formidable cancer. This disease is a stealthy adversary, capable of attacking any part of the body. It's characterized by the uncontrolled growth and spread of abnormal cells. Common symptoms may include fatigue, pain that doesn't go away, unexplained weight loss, and changes in the skin. Diagnosing cancer often involves a combination of imaging tests, lab tests, and biopsies. Once diagnosed, treatment options vary widely depending on the type and stage of the cancer. They can range from surgery and radiation therapy to chemotherapy, immunotherapy, or targeted therapy. Preventing cancer isn't always straightforward, but there are steps you can take to reduce your risk. These include maintaining a healthy weight, eating a balanced diet, getting regular exercise, avoiding tobacco, and limiting alcohol intake. Regular screenings and self-examinations can also help catch this stealthy disease early. Early detection is key in the fight against cancer. At number 3, we find the often overlooked chronic respiratory diseases. These are long-term conditions affecting the airways and other structures of the lung. Common examples include asthma, chronic obstructive pulmonary disease, and pulmonary fibrosis. Their symptoms can be as subtle as a persistent cough, shortness of breath, or even frequent respiratory infections. These conditions are usually diagnosed with a series of tests, including lung function tests, chest X-rays, or CT scans. Treatment options are varied and depend on the severity of the disease. They range from medication, such as bronchodilators or steroids, to lifestyle changes like quitting smoking and exercising regularly. In severe cases, oxygen therapy or even surgery might be necessary. Prevention is key. Regular exercise, a healthy diet, and avoiding smoking or exposure to secondhand smoke can significantly reduce your risk. Breathe easy. Knowledge is your best defense. Number 4 brings us to lower respiratory infections. These are infections that happen in your airways and lungs, a place unseen and often overlooked until symptoms appear. Common symptoms may include a persistent cough, shortness of breath, wheezing, and chest pain. Diagnosis typically involves a physical exam and possibly some diagnostic tests. Your doctor may listen to your lungs, request a chest X-ray, or even take a sample of your mucus to identify the cause of the infection. Treatment options depend on the cause of the infection. They may include antibiotics for bacterial infections or antiviral drugs for viral infections. In severe cases, hospitalization may be required. Prevention, however, is always better than cure. A healthy lifestyle that includes regular exercise, a balanced diet, and avoiding smoking can help keep your respiratory system strong. Vaccinations, such as the flu and pneumococcal vaccines, can also prevent certain types of lower respiratory infections. A simple cough could be more than just a cough. Last but not least, at number 5, we have diabetes. It's a chronic condition where the body struggles to manage blood sugar levels. Common symptoms include excessive thirst, frequent urination, and unexplained weight loss. Diagnosis usually involves a simple blood test. Treatment options range from insulin therapy to lifestyle changes such as a healthy diet and regular exercise. And prevention? Maintaining a balanced diet, regular physical activity, and avoiding tobacco use can significantly reduce the risk. Remember, manage diabetes, don't let it manage you. Knowledge is power, especially when it comes to these deadly diseases. We've taken a deep dive into 5 major health threats that touch lives across the globe. Cardiovascular diseases, often lurking unnoticed, can lead to severe complications, but with regular checkups and a heart-friendly lifestyle, they can be managed. Cancer, the stealthy enemy, has many types and requires early detection for the best chance of successful treatment. Chronic respiratory diseases, the invisible foes, are often triggered by environmental factors and can be prevented by leading a clean, smoke-free life. Lower respiratory infections, although unseen, can be combated with good hygiene practices and timely vaccination. Lastly, the unpredictable diabetes, a silent disruptor, can be controlled with a balanced diet and regular exercise. Stay informed, stay healthy, and remember, prevention is always better than cure. UMCC, your ultimate medical consultant connectors.